Question 1. The audit findings indicate a deviation from the established protocol during a recent patient examination, resulting in a suboptimal image acquisition. The radiologic technologist involved recognizes the error immediately after the procedure. What is the most appropriate course of action according to the principles of incident reporting and management within the American Registry of Radiologic Technologists (AT) framework? Option A. Attempt to re-image the patient without informing anyone to correct the technical error, assuming no harm was done. Option B. Only report the incident verbally to the immediate supervisor, assuming the supervisor will handle any necessary follow-up. Option C. Discuss the error informally with a colleague to understand if similar incidents have occurred, and then proceed with the examination as if the error did not happen. Option D. Immediately document the incident thoroughly in the patient's record, and report it through the facility's official incident reporting system for review and potential corrective action. The correct answer is D. Immediately document the incident thoroughly in the patient's record and report it through the facility's official incident reporting system for review and potential corrective action. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a discrepancy between documented procedures and actual practice, potentially impacting patient safety and regulatory compliance. The radiologic technologist must navigate the immediate need to address the incident, while also considering the long-term implications for quality improvement and adherence to AT standards. The challenge lies in balancing immediate corrective action with the systematic reporting and analysis required by regulatory frameworks. Correct approach analysis. The correct approach involves immediate patient safety assessment, followed by thorough documentation of the incident, and then reporting it through the facility's established incident reporting system. This aligns with the AT emphasis on ethical conduct and professional responsibility, which includes ensuring patient well-being and contributing to a culture of safety. Prompt and accurate reporting allows for investigation, identification of root causes, and implementation of corrective actions, thereby preventing recurrence and upholding professional standards. This systematic process is fundamental to quality assurance in radiologic imaging. Incorrect approaches analysis, failing to report the incident, or only reporting it verbally without formal documentation, violates the principle of accountability and transparency mandated by professional ethics and regulatory guidelines. This omission prevents proper investigation and learning, potentially leading to repeated errors and compromising patient care. It also demonstrates a disregard for established quality improvement processes. Attempting to correct the error without reporting it, or only reporting it to a direct supervisor without following the formal incident reporting system, bypasses the established protocols for incident management. While immediate correction is important, the formal reporting mechanism is crucial for systemic analysis and broader organizational learning. This approach may also be seen as an attempt to conceal the error, which is ethically unsound and can lead to disciplinary action. Focusing solely on the technical aspect of the error without considering the broader implications for patient safety and procedural adherence is insufficient. Incident reporting is not just about identifying a technical mistake, but understanding the circumstances that led to it and how to prevent similar situations in the future. This narrow focus misses the opportunity for comprehensive quality improvement. Professional reasoning. Professionals facing such a situation should first prioritize patient safety. If there is any immediate risk to the patient, that must be addressed first. Following this, the technologist should consult their facility's policies and procedures regarding incident reporting. The ACT Code of Ethics emphasizes the technologist's responsibility to protect the patient and to uphold the integrity of the profession. Therefore, thorough and timely documentation and reporting through the designated channels are paramount. This process allows for objective review, identification of systemic issues, and implementation of effective solutions, ultimately contributing to a safer healthcare environment and maintaining professional standards. Question 2. Consider a scenario where a referring physician requests a complex imaging examination for a patient with a specific, but not immediately life-threatening, condition. The standard protocol for this examination, as outlined in the facility's imaging manual, involves radiation doses that are higher than typical for routine imaging. The radiologic technologist recognizes this and is concerned about adhering to the ALARA principle. What is the most appropriate course of action for the technologist in this situation? Option A. Proceed with the standard higher dose protocol as prescribed, assuming the referring physician has already determined it is necessary and justified. Option B. Discuss the clinical indication with the referring physician to confirm the necessity of the examination and explore potential modifications to the protocol or alternative imaging techniques that could achieve diagnostic quality with a lower radiation dose. Option C. Refuse to perform the examination due to the elevated radiation dose, advising the patient to seek a second opinion. Option D. Unilaterally reduce the radiation dose significantly to ensure a LARA is met, even if it compromises image quality. The correct answer is B. Discuss the clinical indication with the referring physician to confirm the necessity of the examination and explore potential modifications to the protocol or alternative imaging techniques that could achieve diagnostic quality with a lower radiation dose. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging, where a patient's clinical presentation necessitates a specific imaging protocol that inherently involves higher radiation doses. The technologist is tasked with balancing the diagnostic imperative to obtain necessary images with the ethical and regulatory obligation to minimize radiation exposure to the patient. This requires a nuanced understanding of LARA principles beyond simple dose reduction, encompassing the justification of the procedure and optimization of techniques. Correct approach analysis. The correct approach involves a thorough assessment of the clinical indication and a collaborative discussion with the referring physician. This aligns with the fundamental principle of justification, a cornerstone of radiation protection, which dictates that any exposure to ionizing radiation must be justified by the expected benefit to the patient. By engaging with the physician, the technologist ensures the procedure is indeed necessary and explores if alternative, lower-dose imaging techniques or modalities could achieve the diagnostic objective. If the higher-dose protocol is deemed essential, the technologist then focuses on optimization, employing techniques such as appropriate collimation, correct KVP and M as selection, and ensuring optimal patient positioning to achieve the diagnostic image quality with the lowest achievable dose, thereby adhering to the LARA principle. This proactive, collaborative, and technically informed approach represents best professional practice, as it prioritizes patient well-being while fulfilling diagnostic requirements within the regulatory framework. Incorrect approaches analysis. One incorrect approach is to proceed with the higher dose protocol without further investigation or discussion, assuming the referring physician has already justified it. This fails to uphold the technologist's professional responsibility to actively participate in the justification process and to ensure that the lowest effective dose is used. It bypasses a critical step in radiation protection and could lead to unnecessary radiation exposure if the procedure's necessity or alternative methods were not fully considered. Another incorrect approach is to unilaterally reduce the radiation dose significantly without consulting the referring physician or understanding the diagnostic implications. While seemingly aligned with a LARA, this action compromises the diagnostic quality of the images, potentially rendering them non-diagnostic. This violates the principle of optimization, as the goal is to achieve the lowest dose asterisk consistent with diagnostic efficacy asterisk. If the images are not diagnostically useful, the initial exposure was not justified, and the patient may require repeat imaging, leading to a net increase in radiation exposure. A third incorrect approach is to refuse to perform the examination due to the perceived high dose, without exploring any optimization strategies or consulting with the referring physician. This can impede necessary patient care and diagnostic evaluation, potentially causing harm to the patient by delaying or preventing diagnosis. While radiation protection is paramount, it must be balanced with the patient's medical needs. Professional reasoning. Professionals in radiologic technology must employ a decision-making framework that integrates clinical knowledge, regulatory requirements, and ethical considerations. When faced with a protocol involving potentially higher radiation doses, the process should involve 1. Understanding the clinical indication and the rationale for the requested examination. 2. Collaborating with the referring physician to confirm the necessity of the examination and explore alternative imaging strategies or dose reduction techniques. 3. Applying technical expertise to optimize imaging parameters, collimation, exposure factors, positioning, to achieve diagnostic image quality at the lowest achievable dose. 4. documenting the rationale for the chosen protocol and any deviations or discussions. This systematic approach ensures that patient safety and diagnostic efficacy are both prioritized in accordance with AT standards and the principles of radiation protection. Question 3. The review process indicates a need to evaluate a radiologic technologist's understanding of imaging protocols for the female reproductive system. A physician orders an examination to assess for suspected ovarian pathology. Which of the following imaging protocols would be most appropriate to ensure optimal visualization of the ovaries and surrounding pelvic structures? Option A. A limited pelvic X-ray series to evaluate bony structures. Option B. A standard pelvic ultrasound protocol including sagittal and transverse views of the uterus, ovaries, and adnexa with Doppler assessment of ovarian vascularity. Option C. A CT scan of the abdomen and pelvis with intravenous contrast, without specific focus on ovarian detail. Option D. A general abdominal ultrasound protocol focusing on the liver, gallbladder, and kidneys. The correct answer is B. A standard pelvic ultrasound protocol including sagittal and transverse views of the uterus, ovaries, and adnexa, with Doppler assessment of ovarian vascularity. Explanation. The review process indicates a need to assess understanding of reproductive system anatomy and imaging protocols within the context of AT standards. This scenario is professionally challenging because it requires the technologist to apply knowledge of specific anatomical structures and their optimal imaging techniques while adhering to established safety and ethical guidelines. The technologist must consider patient privacy, radiation safety, and the diagnostic efficacy of the chosen protocol. The correct approach represents best professional practice because it prioritizes patient care and diagnostic accuracy by selecting an imaging protocol tailored to the specific anatomical region and potential pathology, while also adhering to radiation safety principles. This aligns with the AT emphasis on competent and ethical practice, ensuring that imaging procedures are performed in a manner that minimizes risk and maximizes diagnostic yield. The AT standards implicitly require technologists to possess and apply this knowledge to provide high-quality patient care. An incorrect approach that involves using a generic pelvic imaging protocol without considering the specific anatomical focus would be professionally unacceptable. This failure stems from a lack of diagnostic intent and could lead to suboptimal image quality, potentially requiring repeat exposures and increasing patient radiation dose unnecessarily. This violates the principle of ALARA, as low as reasonably achievable, and demonstrates a lack of professional judgment in tailoring protocols to individual patient needs. Another incorrect approach, such as omitting specific anatomical landmarks or views crucial for evaluating reproductive organs, would also be unacceptable. This demonstrates a deficiency in anatomical knowledge and protocol application, directly impacting diagnostic accuracy and potentially leading to misdiagnosis or mispathology. This contravenes the AT expectation of technical proficiency and thoroughness in imaging examinations. The professional reasoning process for similar situations should involve a systematic evaluation of the patient's clinical indication, the specific anatomical structures to be visualized, and the available imaging modalities and protocols. Technologists should consult relevant imaging protocols, consider patient factors such as age and gender, and apply principles of radiation protection. A thorough understanding of reproductive system anatomy is fundamental to making informed decisions about optimal imaging techniques, ensuring both diagnostic quality and patient safety. Question 4. Which approach would be most appropriate for a radiologic technologist to implement when performing a fluoroscopic examination on a patient requiring prolonged imaging, where the patient's position necessitates the technologist to be in close proximity to the primary beam? Option A. Rely solely on the lead apron, assuming it provides adequate protection for the duration of the procedure. Option B. Perform the examination without any personal protective equipment, prioritizing patient comfort and procedural speed. Option C. Utilize a full set of personal protective equipment including a lead apron, thyroid shield, and leaded eyewear, while maximizing distance from the radiation source through strategic positioning. Option D. Use only a lead apron and leaded eyewear, as the thyroid is less critical to shield during fluoroscopy. The correct answer is C. Utilize a full set of personal protective equipment including a lead apron, thyroid shield, and leaded eyewear, while maximizing distance from the radiation source through strategic positioning. Explanation. Scenario analysis. This scenario presents a common challenge in radiologic technology where a patient's condition necessitates a procedure that could expose the technologist to increased radiation. Balancing patient care with personal safety while adhering to established protocols requires careful judgment. The technologist must consider not only the immediate need for the examination, but also the long-term implications of radiation exposure. Correct approach analysis. Implementing a comprehensive personal protective equipment (PPE) strategy that includes lead shielding, leaded eyewear, and a thyroid shield, and ensuring proper positioning to maximize distance from the source, represents best professional practice. This approach aligns with the ALARA, as low as reasonably achievable principle, a cornerstone of radiation safety as mandated by the Nuclear Regulatory Commission, NRC, regulations, and echoed in guidelines from professional organizations like the American Registry of Radiologic Technologists, AT. These regulations emphasize the technologist's responsibility to minimize their own radiation dose while providing quality diagnostic imaging. Incorrect approaches analysis. Failing to utilize any lead shielding, relying solely on the lead apron, demonstrates a significant regulatory and ethical failure. This neglects the ALARA principle and exposes the technologist to unnecessary scatter radiation, violating the fundamental duty to protect oneself. Opting for only a lead apron and leaded eyewear, but omitting thyroid shielding, is also professionally unacceptable. The thyroid gland is particularly radiosensitive, and failing to shield it, even with other protective measures in place, represents a lapse in comprehensive radiation protection, potentially leading to long-term health risks and a violation of best practice guidelines. Choosing to forego all PPE due to a perceived time constraint or patient discomfort, without exploring alternative positioning or shielding options, is a direct contravention of established radiation safety protocols and ethical obligations. This prioritizes expediency over safety, which is never justifiable in a regulated healthcare environment. Professional reasoning. Professionals should approach such situations by first assessing the specific imaging requirements and the patient's condition. They should then consult established protocols for radiation protection. If the standard protocol is insufficient or poses a significant personal risk, the technologist should explore all available PPE options, including lead aprons, thyroid shields, leaded eyewear, and leaded gloves if applicable. Maximizing distance from the source through appropriate positioning is also a critical component. If these measures are still insufficient, the technologist should consult with a supervisor or radiation safety officer to determine the safest course of action, ensuring that patient care is not compromised, but that personal safety is paramount and in compliance with all regulatory requirements. Question 5. Strategic planning requires a radiologic technologist to consider how various technical factors influence the diagnostic quality of an image. When faced with imaging a patient with a significant amount of soft tissue, which of the following adjustments would most effectively enhance image contrast while minimizing unnecessary radiation exposure? Option A. Decrease kilovoltage peak, kVp, and decrease collimation. Option B. Decrease kilovoltage peak, kVp, and increase milliampere-seconds m as while ensuring appropriate collimation. Option C. Increase milliampere-seconds m as and decrease source-to-image receptor distance SID. Option D. Increase kilovoltage peak, kVp, and decrease milliampere-seconds m as while ensuring appropriate collimation. The correct answer is D. Increase kilovoltage peak, kVp, and decrease milliampere-seconds m as while ensuring appropriate collimation. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging, optimizing image quality for accurate diagnosis while managing patient dose and procedural efficiency. The radiologic technologist must balance multiple technical factors that influence contrast, density, and resolution. Failure to do so can lead to suboptimal images requiring repeat exposures, increasing patient dose, and potentially delaying diagnosis. The professional challenge lies in applying theoretical knowledge of image formation to a practical clinical situation, making informed decisions based on patient factors and equipment capabilities. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic efficacy by selecting technical factors that optimize image quality within acceptable dose limits. This involves understanding the interplay between kilovoltage peak, kVp, milliampere seconds m as source-to-image receptor distance SID, and collimation. For example, adjusting kVp primarily affects contrast, while m as influences density. Appropriate collimation reduces scatter radiation, enhancing contrast and resolution. Selecting the correct focal spot size and ensuring proper patient positioning are crucial for achieving optimal spatial resolution. This approach aligns with the American Registry of Radiologic Technologists AT standards, which emphasize the technologist's responsibility in producing diagnostic quality images while adhering to radiation protection principles. The AT Code of Ethics guides technologists to provide patient care with compassion and respect, which includes minimizing unnecessary radiation exposure and ensuring the best possible diagnostic information is obtained. Incorrect approaches analysis. One incorrect approach might involve solely prioritizing image density by excessively increasing M, as without considering the impact on contrast and potential for overexposure. This violates radiation protection principles by delivering unnecessary radiation to the patient and can lead to a loss of subtle contrast, hindering diagnostic interpretation. Another incorrect approach could be to neglect collimation, leading to increased scatter radiation. Scatter degrades contrast and resolution, making the image less diagnostic and exposing the patient to additional radiation. Third incorrect approach might be to overlook the importance of appropriate focal spot selection or patient positioning, which directly impacts spatial resolution. Poor resolution can obscure fine details, leading to misdiagnosis. These approaches fail to meet the AT ethical and professional standards by compromising image quality and patient safety. Professional reasoning. Professionals should employ a systematic decision-making framework when selecting technical factors. This framework begins with assessing the patient's condition and the specific examination required. Next, the technologist should consider the anatomical region being imaged and its typical attenuation characteristics. Then, they should evaluate the available equipment and its capabilities. Based on this information, the technologist can then select initial technical factors, prioritizing a balance between contrast, density, and resolution. Crucially, they must also consider radiation protection principles, using the lowest practical M as an appropriate kVp and employing effective collimation. Finally, a critical evaluation of the initial image is performed, and adjustments are made as necessary to achieve optimal diagnostic quality while minimizing patient dose. This iterative process ensures that the technologist is actively managing image quality and patient safety. Question 6. Stakeholder feedback indicates that some radiographers struggle with achieving optimal visualization of specific skeletal anatomy in challenging patient positioning scenarios. For a requested lateral projection of the lumbar spine, a patient reports significant pain when attempting to fully rotate their body to achieve a perfect lateral position, potentially obscuring the intervertebral foramina. Which of the following approaches best ensures diagnostic image quality while respecting patient comfort? Option A. Position the patient in a slightly anterior oblique position to better visualize the anterior aspect of the vertebral bodies, as this is a more stable position for patients experiencing posterior pain. Option B. Prioritize achieving a clear profile view of the intervertebral foramina by using compensatory positioning techniques, even if it means the patient is in a position of mild discomfort, as this is critical for evaluating nerve root impingement. Option C. Adjust the patient's rotation to minimize discomfort, even if it results in slight obliquity of the vertebral bodies and less distinct visualization of the intervertebral foramina. Option D. Attempt standard positioning for a true lateral, using immobilization devices and verbal encouragement, and proceed with the exposure if the patient can tolerate it, accepting that some foraminal overlap may occur. The correct answer is C. Adjust the patient's rotation to minimize discomfort, even if it results in slight obliquity of the vertebral bodies and less distinct visualization of the intervertebral foramina. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging, where patient positioning can significantly impact the diagnostic quality of a radiograph, particularly when assessing skeletal anatomy. The radiographer must balance the need for accurate anatomical representation with patient comfort and safety, especially when dealing with potential pathology that might limit mobility or cause pain. The challenge lies in identifying the most critical radiographic landmark for the specific examination and ensuring its proper visualization despite potential patient limitations. Correct approach analysis. The correct approach prioritizes the visualization of the most critical radiographic landmark for the requested examination. In the context of a lateral lumbar spine radiograph, the intervertebral foramina are often of primary diagnostic interest, and their clear visualization is dependent on precise patient positioning. Ensuring the posterior aspect of the vertebral bodies is superimposed and the intervertebral foramina are visualized in profile is paramount for accurate assessment of potential nerve root impingement or other pathologies within these structures. This aligns with the emphasis on producing diagnostic quality images that accurately represent the anatomy and pathology, thereby supporting accurate clinical diagnosis. Incorrect approaches analysis. One incorrect approach involves prioritizing patient comfort over the diagnostic quality of the image. While patient comfort is important, it should not supersede the fundamental requirement of obtaining a diagnostically useful radiograph. If the patient's discomfort leads to suboptimal positioning that obscures critical anatomical landmarks like the intervertebral foramina, the resulting image may be non-diagnostic, leading to repeat exposures or misdiagnosis. This failure to produce a diagnostic image violates the professional responsibility to provide effective patient care and adhere to imaging standards. Another incorrect approach is to assume that a standard positioning technique will suffice without assessing the patient's specific limitations. Skeletal anatomy and the ability to achieve ideal positioning can vary significantly between individuals, especially in the presence of pain or injury. Failing to adapt positioning based on the patient's condition can result in an incomplete or inaccurate representation of the anatomy, hindering the radiologist's ability to make a diagnosis. This demonstrates a lack of critical thinking and patient-centered care, which are core tenets of radiologic practice. A further incorrect approach is to focus on a landmark that is secondary in importance for the specific examination. For a lateral lumbar spine, while the vertebral bodies are visible, the intervertebral foramina are often the primary area of concern for certain pathologies. Focusing on the anterior aspect of the vertebral bodies, for instance, might be less critical than ensuring the foramina are clearly demonstrated. This misprioritization of anatomical landmarks can lead to a radiograph that is technically acceptable in some regards, but fails to provide the necessary information for the intended diagnosis. Professional reasoning. When faced with a patient who may have difficulty achieving ideal positioning for a lateral lumbar spine radiograph, the radiographer should first identify the primary diagnostic objective of the examination. This involves understanding which anatomical structures are of greatest interest to the referring physician. Next, the radiographer must assess the patient's ability to cooperate and tolerate specific positions. Based on this assessment, the radiographer should employ positioning techniques that best visualize the critical landmarks, in this case, the intervertebral foramina, while minimizing patient discomfort and ensuring image quality. This may involve using sponges, adjusting the degree of rotation, or employing alternative positioning methods as appropriate, always with the goal of producing a diagnostic quality image that supports accurate clinical interpretation. Adherence to standards for image quality and patient care is paramount. Question 7. The investigation demonstrates a patient presenting with acute abdominal pain localized to the right lower quadrant, accompanied by nausea and a low-grade fever. The technologist is tasked with performing an abdominal ultrasound, considering the typical anatomical structures and physiological functions of this region. Which of the following anatomical considerations is most critical for guiding the ultrasound protocol to effectively evaluate the potential source of the patient's symptoms? Option A, the normal appearance and motility of the stomach and duodenum. Option B, the overall size and contour of the liver and gallbladder and their typical vascular supply. Option C, the precise location and relationship of the appendix to the cecum and terminal ileum, and the potential for inflammation or obstruction. Option D, the anatomical position and function of the spleen and pancreas in relation to the stomach. The correct answer is C, the precise location and relationship of the appendix to the cecum and terminal ileum, and the potential for inflammation or obstruction. Explanation. The investigation demonstrates a scenario where a radiologic technologist is faced with a patient presenting with symptoms suggestive of a specific anatomical abnormality. The challenge lies in accurately identifying the relevant anatomical structures and their physiological functions to ensure appropriate imaging protocols are selected. thereby minimizing radiation exposure while maximizing diagnostic yield. This requires a strong foundational understanding of anatomy and physiology, which is a core competency assessed by the AT. The correct approach involves a systematic review of the patient's symptoms and medical history to correlate them with known anatomical landmarks and physiological processes. This allows the technologist to anticipate the most likely affected areas and choose imaging parameters that best visualize these structures. This aligns with AT emphasis on the technologist's responsibility to apply knowledge of anatomy and physiology to patient care and image acquisition, ensuring compliance with radiation safety standards and diagnostic accuracy. An incorrect approach would be to proceed with a generic imaging protocol without considering the specific anatomical and physiological implications of the patient's presentation. This could lead to suboptimal image quality, misdiagnoses, or unnecessary radiation exposure, failing to meet the professional standards of care and AT expectations for competent practice. Another incorrect approach would be to rely solely on the referring physician's limited description without independently considering the underlying anatomy and physiology, potentially overlooking critical diagnostic information. A third incorrect approach would be to guess at the correct anatomical location or physiological process, which is a direct contravention of the need for evidence-based practice and professional accountability. The professional decision-making process in such a situation should involve 1. Actively listening to and understanding the patient's symptoms and history. 2. Recalling and applying knowledge of relevant anatomy and physiology to hypothesize potential pathologies. 3. Consulting appropriate imaging protocols and anatomical references if necessary. 4. Collaborating with the radiologist to refine the imaging approach based on the anatomical and physiological considerations. This systematic process ensures patient safety, diagnostic accuracy, and adherence to regulatory requirements. Question 8. The performance metrics show a consistent pattern of underexposed images with high noise levels for lateral thoracic spine radiography, despite the KVP and sourced image receptor distance, SID, being set according to departmental protocol. The radiographer is considering adjustments to improve image quality. Option A. Accept the current image quality as within acceptable diagnostic limits. Option B. Increase the sourced image receptor distance, SID. Option C. Increase the kilovoltage peak KVP value significantly. Option D. Increase the milliampere-second M-as value. The correct answer is D. Increase the milliampere-second M-as value. Explanation. The performance metrics show a consistent trend of suboptimal image quality in a specific radiographic examination, characterized by excessive noise and poor contrast, despite adherence to departmental protocols for KVP and SID. This scenario is professionally challenging because it requires the radiographer to move beyond simply following established protocols and engage in critical thinking to identify the root cause of the image quality degradation. It demands an understanding of how exposure factors interact and influence image receptor performance, and the ability to troubleshoot effectively within the constraints of patient safety and regulatory compliance. The correct approach involves recognizing that while KVP and SID are set, the milliampere-second M as value, which directly controls the quantity of radiation, may be insufficient to achieve adequate signal-to-noise ratio for the specific imaging system and patient anatomy. Adjusting M as to increase the overall radiation exposure, while maintaining appropriate KVP for penetration and SID for geometric integrity, represents best professional practice. This aligns with the American Registry of Radiologic Technologists, AT, standards of ethics, which emphasize the radiographer's responsibility to provide quality patient care and produce diagnostic images. Specifically, Standard Roman II states that radiologic technologists shall act in the best interests of the patient. Producing diagnostic images is in the patient's best interest, as it facilitates accurate diagnosis and treatment, and avoids the need for repeat examinations, which increase patient dose. Furthermore, AT content specifications for the examination include understanding the relationship between KVP, M-as, and SID, and their impact on image quality and patient dose. An incorrect approach would be to solely increase KVP to improve penetration and reduce noise, without considering the potential for increased scatter radiation and its detrimental effect on contrast, or the impact on patient dose. This fails to address the fundamental issue of insufficient radiation quantity. Another incorrect approach would be to increase SID, which would reduce patient dose but also significantly decrease image receptor exposure, exacerbating the noise problem and requiring a substantial increase in M, as potentially leading to longer exposure times and increased motion unsharpness. Simply accepting the suboptimal image quality and continuing with the current settings is also professionally unacceptable, as it violates the ethical obligation to provide diagnostic quality imaging and potentially compromises patient care by delaying or hindering accurate diagnosis. The professional decision-making process for such situations should involve a systematic evaluation of the imaging chain. First, confirm that the KVP and SID are appropriate for the specific examination and patient size according to established protocols and ACT guidelines. If these are confirmed, then critically assess the M as value. Consider the inherent limitations of the imaging system and the need for sufficient photon flux to overcome electronic noise and achieve adequate signal. If image quality is compromised by noise and low contrast, and KVP and SID are appropriate, then increasing M as is the most direct and effective way to improve the signal-to-noise ratio and contrast resolution, while carefully monitoring patient dose. This iterative process of evaluation, adjustment, and reassessment is crucial for maintaining diagnostic image quality and adhering to professional and ethical standards. Question 9. Performance analysis shows that imaging protocols for evaluating specific muscle pathologies require precise anatomical visualization. When a physician orders an examination specifically to assess the supraspinatus muscle, which of the following approaches best ensures diagnostic quality and adheres to professional imaging standards? Option A. Perform a standard AP projection of the shoulder, relying on the patient's comfort to guide positioning. Option B. Employ a general soft tissue imaging protocol for the upper extremity without specific anatomical consideration. Option C. Use a protocol designed for imaging bone fractures in the shoulder region. Option D. Utilize a supraspinatus outlet view, scapular Y or outlet view, with appropriate collimation and technique factors. The correct answer is A. Perform a standard AP projection of the shoulder, relying on the patient's comfort to guide positioning. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging where patient positioning and technique directly impact the visualization of specific muscular structures, particularly in the extremities. The professional challenge lies in balancing the need for diagnostic quality images with patient comfort, radiation safety, and the efficient use of resources. A radiologic technologist must possess a thorough understanding of musculoskeletal anatomy and the principles of image acquisition to select the most appropriate protocol for the clinical indication. Failure to do so can lead to suboptimal images requiring repeat exposures, increasing patient dose and delaying diagnosis. Correct approach analysis. The correct approach involves a systematic evaluation of the clinical indication and the specific muscle group in question. For imaging the supraspinatus muscle, understanding its anatomical location within the subacromial space of the shoulder is paramount. The technologist must then select imaging parameters and positioning that optimize visualization of this muscle, considering potential artifacts from overlying bone or soft tissue. This often involves specific projections like the supraspinatus outlet view, also known as the scapular Y or outlet view, which is designed to demonstrate the space between the acromion and the humeral head, thereby visualizing the supraspinatus tendon and muscle belly clearly. Adherence to established imaging protocols, often guided by ACT content specifications and departmental guidelines, ensures diagnostic quality and patient safety, aligning with the ACT emphasis on competence and ethical practice. Incorrect approaches analysis. One incorrect approach would be to perform a standard AP shoulder projection without specific attention to the supraspinatus. This is inadequate because the standard AP view may not adequately demonstrate the supraspinatus muscle and tendon due to overlying bony structures and the muscle's specific anatomical orientation. This failure to tailor the examination to the clinical need violates the principle of providing diagnostic quality imaging, potentially leading to missed pathology and increased radiation exposure due to repeat imaging. Another incorrect approach would be to rely solely on patient-reported pain to guide positioning, without understanding the underlying anatomy and imaging principles. Patient feedback is important for comfort. It does not substitute for the technologist's knowledge of optimal imaging techniques for specific pathologies. This approach risks producing images that are not diagnostically useful, even if the patient is comfortable. A third incorrect approach would be to use a protocol designed for a different anatomical region or pathology, such as a chest X-ray protocol, for imaging the shoulder. This is a fundamental failure in applying imaging knowledge and directly contravenes the AD expectations for competent practice. Such an approach would yield images entirely unsuitable for evaluating the supraspinatus muscle, representing a significant ethical and professional lapse. Professional reasoning. When faced with a request to image a specific muscle group, a radiologic technologist should employ a decision-making process that begins with understanding the clinical question. This involves reviewing the requisition and consulting with the referring physician or radiologist if clarification is needed. Next, the technologist must access their knowledge of musculoskeletal anatomy and the principles of radiographic positioning and technique relevant to the targeted structure. They should then select or adapt an imaging protocol that is known to effectively demonstrate the muscle in question, considering factors like patient anatomy, potential artifacts, and radiation safety. Finally, the technologist should critically evaluate the acquired images for diagnostic quality before concluding the examination, ensuring that the images meet the requirements for accurate interpretation. This systematic approach, grounded in anatomical knowledge and imaging physics, is essential for providing high-quality patient care and upholding professional standards as outlined by the AD. Question 10. Quality control measures reveal that a radiologic technologist has been sharing their login credentials with a colleague to expedite image retrieval for a referring physician. Which of the following actions best upholds professional and ethical responsibilities regarding image storage and retrieval systems? Option A. Suggest that the technologists leave their workstation unlocked when stepping away briefly to retrieve images for a physician. Option B. Advise the colleague to continue sharing credentials when necessary, as long as the referring physician is waiting for the images. Option C. Allow any staff member to access the PACS workstation if they claim to need an image quickly for patient care. Option D. Immediately report the credential sharing to the department supervisor and ensure all technologists are reminded of the policy against sharing login information. The correct answer is D. Immediately report the credential sharing to the department supervisor and ensure all technologists are reminded of the policy against sharing login information. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare imaging departments where the integrity and accessibility of patient imaging data are paramount. The professional challenge lies in balancing the need for efficient image retrieval with the stringent requirements for data security, patient privacy, and regulatory compliance, specifically under the purview of the American Registry of Radiologic Technologists, at ethical and professional standards, which implicitly guide best practices in image management. Ensuring that all personnel understand and adhere to these protocols is crucial to prevent breaches and maintain patient trust. Correct approach analysis. The correct approach emphasizes the radiologic technologist's responsibility to ensure that only authorized personnel with a legitimate need access patient images. This aligns with the ACT Code of Ethics, which stresses the importance of patient confidentiality and the technologist's duty to protect patient information. Proper authentication and authorization protocols are fundamental to maintaining the integrity of the picture archiving and communication system, PACS, and preventing unauthorized access, which is a core tenet of responsible medical imaging practice. Incorrect approaches analysis. An approach that suggests sharing login credentials among technologists is a direct violation of patient privacy and data security principles. This practice bypasses audit trails, making it impossible to determine who accessed specific images, and increases the risk of unauthorized disclosure of protected health information, FI, which is contrary to the spirit of AD ethical guidelines. Another incorrect approach, allowing any staff member to retrieve images without verification of their role or need, creates significant security vulnerabilities. This could lead to accidental or intentional breaches of patient confidentiality, exposing sensitive medical data to individuals who are not involved in the patient's care, and thus failing to uphold professional ethical obligations. Finally, an approach that prioritizes speed of retrieval over security protocols, such as leaving the PACS workstation unlocked or accessible to anyone passing by, demonstrates a disregard for patient privacy and data integrity. This creates an environment where PHI is easily compromised, directly contradicting the ethical responsibilities of a radiologic technologist to safeguard patient information. Professional reasoning. When faced with situations involving image storage and retrieval systems, radiologic technologists must adopt a decision-making process that prioritizes patient confidentiality, data security, and regulatory compliance. This involves understanding and consistently applying established protocols for user authentication, access control, and data handling. If a situation arises where existing protocols seem inefficient or are unclear, the professional course of action is to consult with supervisors or the department's IT/PACS administrator to clarify procedures or advocate for improvements that maintain security while enhancing workflow, rather than circumventing established security measures. Question 11. Stakeholder feedback indicates a need to reinforce the understanding of image processing techniques among radiologic technologists. When presented with a digital radiographic image where subtle lung nodules are not clearly visualized due to suboptimal contrast, which of the following actions best reflects adherence to AD standards for producing diagnostic quality images? Option A. Leave the image as acquired, assuming the interpreting physician can compensate for any visualization issues. Option B. Adjust the window width and level settings to optimize the contrast and brightness of the lung parenchyma, thereby enhancing the visibility of potential nodules. Option C. Increase the overall brightness of the image significantly to make all structures appear lighter, regardless of their original density. Option D. Apply a high-pass filter to the image to sharpen all edges, even if it introduces noise and obscures subtle details. The correct answer is B. Adjust the window width and level settings to optimize the contrast and brightness of the lung parenchyma, thereby enhancing the visibility of potential nodules. Explanation. This scenario is professionally challenging because it requires the radiologic technologist to balance the need for diagnostic image quality with patient safety and regulatory compliance. The technologist must understand how image processing techniques, specifically windowing and leveling, affect the visibility of anatomical structures and potential pathology, while also adhering to the standards set forth by the American Registry of Radiologic Technologists, AD. The AD emphasizes the technologist's responsibility for producing diagnostic quality images and understanding the principles behind image acquisition and manipulation. The correct approach represents best professional practice because it demonstrates a thorough understanding of image processing as a tool to optimize diagnostic information without altering the fundamental integrity of the image data. By adjusting window width and level, the technologist can enhance the contrast and brightness of specific tissues or structures of interest, thereby improving the ability to detect subtle abnormalities. This aligns with the AD expectation that technologists produce images that are technically adequate for interpretation by a qualified medical professional. This practice is ethically sound as it directly contributes to accurate diagnosis and patient care, and it is compliant with AD standards that require competence in image manipulation for diagnostic purposes. An incorrect approach that involves excessive windowing or leveling to create an aesthetically pleasing image that misrepresents the actual tissue densities would be professionally unacceptable. This would constitute a failure to adhere to AD standards for producing diagnostic quality images, as it could obscure pathology or create artifacts that lead to misinterpretation. Ethically, this is a breach of professional responsibility, as it compromises the integrity of the diagnostic process and potentially harms the patient. Another incorrect approach, such as failing to adjust windowing and leveling at all, even when the initial image is suboptimal for visualization of critical structures, would also be a failure. This demonstrates a lack of understanding of image processing's role in diagnostic imaging and could lead to misdiagnoses, which is a violation of the technologist's duty to provide competent care. The professional reasoning process for similar situations should involve a systematic evaluation of the initial image. The technologist must first assess if the image is diagnostically adequate. If not, they should consider the specific anatomical region and suspected pathology to determine the appropriate window width and level settings. This involves understanding the typical densities of different tissues and how windowing and leveling manipulate the display of these densities. The technologist should then apply these adjustments judiciously, always prioritizing the enhancement of diagnostic information over purely aesthetic qualities. Finally, they should review the adjusted image to ensure that no artifacts have been introduced and that the diagnostic quality has been genuinely improved, remaining within the bounds of acceptable image manipulation as guided by AT principles. Question 12. System analysis indicates that a radiologic technologist has just completed an abdominal radiograph on a pediatric patient. Upon reviewing the image, the technologist notices significant motion blur, rendering the image diagnostically suboptimal for assessing the abdominal organs. The technologist is considering how to proceed. Which of the following represents the most appropriate course of action according to radiation physics and safety principles relevant to the AD examination? Option A. Assess the cause of the motion blur and repeat the exposure with adjusted technical factors and appropriate immobilization techniques. Option B. Accept the current image as is to avoid additional radiation exposure to the patient. Option C. Immediately repeat the exposure with higher kVp to reduce the exposure time and minimize motion. Option D. Repeat the exposure using the same technical factors but ensuring the patient remains as still as possible. The correct answer is D. Repeat the exposure using the same technical factors but ensuring the patient remains as still as possible. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging where a technologist must balance the need for diagnostic image quality with the imperative to minimize patient radiation dose. The technologist is faced with a situation where the initial exposure parameters may not have yielded optimal results, potentially requiring a repeat exposure. The professional challenge lies in determining the most appropriate course of action without compromising patient safety or diagnostic efficacy, adhering strictly to AT standards and radiation safety principles. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic quality by first evaluating the existing image for diagnostic acceptability. If the image is diagnostically inadequate due to factors like motion blur or improper positioning, a repeat exposure is justified. However, before repeating, the technologist must analyze the cause of the inadequacy and adjust technical factors, kVp, m as distance, collimation, to optimize dose and image quality for the repeat. This aligns with the ALARA, as low as reasonably achievable principle, a cornerstone of radiation safety mandated by regulatory bodies and emphasized by the AT. It also reflects the technologist's responsibility to produce diagnostic images as per professional standards. Incorrect approaches analysis. One incorrect approach is to immediately repeat the exposure without assessing the original image. This fails to acknowledge the possibility that the initial image might be diagnostically acceptable, leading to unnecessary radiation exposure to the patient, violating the ALARA principle. Another incorrect approach is to accept a diagnostically suboptimal image to avoid repeating the exposure. This compromises patient care by providing an image that may not yield a definitive diagnosis, potentially leading to further imaging or misdiagnosis, and failing the technologist's primary duty of producing quality diagnostic images. A third incorrect approach is to repeat the exposure using the exact same parameters without any adjustment. This demonstrates a lack of understanding of how to optimize technical factors for dose reduction and image enhancement, and it fails to address the root cause of any potential inadequacy in the initial exposure. Professional reasoning. Professionals should adopt a systematic approach. 1. Evaluate the diagnostic quality of the current image. 2. If inadequate, identify the cause, e.g., motion positioning technique. 3. If a repeat is necessary, adjust technical factors, kVp, m as collimation, SID, to optimize for dose and image quality, adhering to ALARA. 4. Perform the repeat exposure with the adjusted parameters. 5. Re-evaluate the repeat image for diagnostic acceptability. This process ensures that patient dose is minimized while diagnostic efficacy is maximized, reflecting ethical and professional responsibilities. Question 13. Implementation of a chest radiography examination for a patient experiencing significant dyspnea requires careful consideration of their respiratory status. The patient reports difficulty taking a deep breath and holding it for the required duration, Which of the following approaches best addresses this situation while adhering to professional standards for diagnostic imaging? Option A. Advise the patient to take a shallower breath and hold it for a shorter duration, explaining that this adjustment is made due to their breathing difficulty, and proceed with the exposure. Option B. Proceed with the examination using a higher kVp and lower M as to compensate for potential motion blur caused by the patient's inability to hold their breath. Option C. Instruct the patient to take the deepest breath possible and hold it, regardless of their reported discomfort, to ensure optimal lung expansion for the image. Option D. Immediately cancel the examination and refer the patient to their physician for further evaluation of their respiratory distress before attempting any imaging. The correct answer is C. Instruct the patient to take the deepest breath possible and hold it, regardless of their reported discomfort, to ensure optimal lung expansion for the image. Explanation. This scenario presents a common challenge in diagnostic imaging where patient condition directly impacts the quality and safety of the examination. The professional must balance the need for diagnostic information with the patient's immediate physiological status, specifically their respiratory function. The ad emphasizes the radiographer's responsibility to ensure patient safety and to produce diagnostic quality images. This requires understanding how patient positioning and breathing techniques affect image acquisition, particularly in the context of respiratory compromise. The correct approach prioritizes patient well-being and the ability to obtain a diagnostic study by adapting the imaging protocol to the patient's limitations. This aligns with the ad ethical standards, which require radiographers to act in the best interest of the patient and to maintain competence in their practice. By considering the patient's dyspnea and adjusting the breathing instructions, the radiographer demonstrates a commitment to patient care and image optimization within the constraints of the patient's condition. This also reflects an understanding of how respiratory mechanics influence image clarity, especially in chest radiography where lung expansion is critical. An incorrect approach that ignores the patient's dyspnea and proceeds with standard, forceful breathing instructions would be professionally unacceptable. This failure to adapt to the patient's condition could lead to patient distress, inability to hold their breath adequately, and ultimately, suboptimal or non-diagnostic images. Ethically, this demonstrates a lack of patient advocacy and a disregard for the patient's comfort and safety. Furthermore, it may violate AD standards related to patient care and the production of diagnostic quality images. Another incorrect approach, such as immediately terminating the examination without attempting any modifications, would also be professionally problematic. While patient safety is paramount, a radiographer is expected to explore all reasonable options to obtain a diagnostic study. This approach might indicate a lack of problem-solving skills or an unwillingness to adapt protocols, potentially leading to unnecessary repeat examinations or delayed diagnosis for the patient. It fails to demonstrate the professional judgment required to manage challenging patient situations effectively. The professional decision-making process in such a situation involves a rapid assessment of the patient's condition, a review of the imaging protocol, and consideration of alternative techniques. The radiographer must weigh the potential risks and benefits of different approaches, always prioritizing patient safety and the diagnostic yield of the examination. This requires a strong understanding of respiratory anatomy and physiology as it relates to imaging, as well as a commitment to continuous learning and adaptation of skills. Question 14. Governance review demonstrates a radiologic technologist is reviewing a patient's chart following a lengthy interventional fluoroscopy procedure. The patient reports experiencing nausea and skin redness at the site of the procedure, which began approximately 12 hours after the examination. The technologist recalls that the patient received a relatively high dose of radiation during the procedure. Considering the biological effects of radiation and the patient's reported symptoms, what is the most appropriate immediate action for the technologist? Option A. Focus on calculating the precise cumulative radiation dose to the patient and compare it to established occupational exposure limits. Option B. Document the patient's reported symptoms and the procedure details accurately in the patient's record and immediately notify the supervising radiologist of the patient's subjective complaints and the observed skin changes. Option C. Reassure the patient that the radiation dose received was within acceptable diagnostic limits and that no adverse effects are expected. Option D. Advise the patient that nausea and skin redness are common side effects of radiation and that they will likely resolve on their own without further intervention. The correct answer is B. Document the patient's reported symptoms and the procedure details accurately in the patient's record and immediately notify the supervising radiologist of the patient's subjective complaints and the observed skin changes. Explanation. Scenario analysis. This scenario presents a challenge in applying knowledge of radiation biology to patient care in a practical setting. The technologist must interpret a patient's history and current condition in light of potential radiation-induced effects, necessitating a nuanced understanding beyond simple dose calculations. The professional challenge lies in accurately assessing the likelihood and nature of radiation effects, distinguishing between acute and stochastic outcomes, and understanding the implications for patient management and communication, all within the framework of AD standards for ethical and competent practice. Correct approach analysis. The correct approach involves recognizing that the patient's symptoms, occurring shortly after a high-dose fluoroscopic procedure, are highly suggestive of an acute radiation syndrome. This aligns with the AD emphasis on understanding the biological effects of radiation to ensure patient safety and provide appropriate care. Specifically, the technologist's role includes recognizing potential adverse effects, understanding their dose dependence, and communicating relevant observations to the radiologist. This demonstrates a commitment to patient well-being and adherence to the principle of minimizing harm, a core ethical tenet for radiologic technologists. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's symptoms as unrelated to the procedure, perhaps attributing them to anxiety or a pre-existing condition, without considering the temporal relationship to radiation exposure. This fails to acknowledge the well-established dose-response relationship for acute radiation effects and could lead to delayed or misdiagnosis of a radiation-induced injury, violating the AD ethical guidelines regarding patient care and professional responsibility. Another incorrect approach would be to focus solely on the radiation dose received without considering the clinical presentation. While dose is a critical factor, the biological effects are manifested through symptoms. Ignoring the patient's reported discomfort and physical signs, and solely relying on a numerical dose value, would be a failure to integrate all available information for a comprehensive assessment, which is contrary to best practices in patient management. A third incorrect approach would be to provide definitive medical advice or diagnosis to the patient regarding the radiation effects. Radiologic technologists are not licensed to diagnose or prescribe treatment. Overstepping professional boundaries in this manner is a violation of AD ethical standards and could have serious consequences for the patient and the technologist. Professional reasoning. Professionals should approach such situations by first recalling the principles of radiation biology, including the types of radiation effects, deterministic vs. stochastic, and their dose thresholds. They should then correlate the patient's reported symptoms and the timing of their onset with the known effects of radiation exposure from the specific procedure performed. This information should be communicated clearly and concisely to the supervising radiologist, who is responsible for the medical diagnosis and management plan. The technologist's role is to be an observant and informed member of the healthcare team, contributing to patient safety through accurate observation and communication within their scope of practice. Question 15. Investigation of the fundamental concepts of radiation biology in diagnostic imaging reveals distinct dose-response relationships for different types of radiation-induced effects. Which of the following statements accurately differentiates between deterministic and stochastic radiation effects as understood within the AD framework? Option A. Stochastic effects are always observable and have a threshold dose, while deterministic effects are purely probabilistic and increase in probability with dose. Option B. Both deterministic and stochastic effects have a threshold dose, and their severity is directly proportional to the radiation dose received. Option C. Deterministic effects are always severe and have no threshold, whereas stochastic effects have a threshold and their severity is dose-dependent. Option D. Deterministic effects are characterized by a threshold dose and increasing severity with dose, while stochastic effects are probabilistic, with no known threshold and increasing probability of occurrence with dose. The correct answer is D. Deterministic effects are characterized by a threshold dose and increasing severity with dose, while stochastic effects are probabilistic, with no known threshold and increasing probability of occurrence with dose. Explanation. Scenario analysis. This scenario presents a professional challenge in a diagnostic imaging setting where a radiologic technologist must accurately assess the potential for radiation-induced biological effects based on fundamental concepts of radiation. The challenge lies in distinguishing between deterministic and stochastic effects, understanding their dose-response relationships, and applying this knowledge to patient care and safety protocol. Misinterpreting these concepts could lead to inappropriate radiation management, potentially compromising patient well-being and violating established professional standards. Correct approach analysis. The correct approach involves recognizing that deterministic effects, such as skin erythema or hair loss, have a threshold dose below which they do not occur, and their severity increases with dose. Stochastic effects, like cancer induction or genetic mutations, are probabilistic, meaning they have no known threshold and their probability of occurrence increases with dose, but their severity is independent of dose. This understanding is crucial for implementing ALARA, as low as reasonably achievable, principles, optimizing imaging parameters, and providing accurate patient information, all of which are foundational to AT standards for radiation safety and patient care. Incorrect approach is analysis. One incorrect approach is to assume that all radiation effects are deterministic and have a threshold, leading to a potentially false sense of security at lower doses. This fails to acknowledge the probabilistic nature of stochastic effects, which are a primary concern in diagnostic radiology, where cumulative doses can increase cancer risk over a lifetime. Another incorrect approach is to believe that stochastic effects are always severe, regardless of the dose, which can lead to unnecessary anxiety for patients and potentially hinder necessary diagnostic imaging. A third incorrect approach is to conflate the mechanisms of deterministic and stochastic effects, leading to flawed risk assessments and inadequate protective measures. These misinterpretations directly contradict the AD emphasis on understanding radiation biology and safety principles. Professional reasoning. Radiologic technologists should employ a decision-making process that prioritizes accurate comprehension of radiation biology. This involves continuous learning and adherence to AT guidelines regarding radiation physics and biology. When faced with situations requiring the application of radiation principles, professionals should 1. Identify the type of radiation effect being considered deterministic vs. stochastic. 2. Recall the characteristic dose-response relationship for that effect. 3. Apply this knowledge to optimize radiation protection for the patient and themselves, adhering to ALARA. 4. Communicate effectively with patients and other healthcare professionals, based on sound scientific understanding. Question 16. Compliance review shows that a radiologic technologist consistently positions patients for a standard AP chest radiograph, but often the scapulae are superimposed over the lung fields, obscuring visualization. The technologist states they are following the standard AP positioning protocol. Which of the following approaches best addresses this compliance issue and ensures diagnostic image quality according to AT standards? Option A. Explaining to the patient that the scapulae will be superimposed and that this is a standard limitation of the AP chest projection, proceeding with the standard positioning. Option B. Requesting an alternative projection such as a lateral chest for all patients where scapular overlap is anticipated to avoid the issue altogether. Option C. Adjusting patient positioning to ensure the scapulae are rotated away from the lung fields, even if it requires a slight rotation of the patient's shoulders anteriorly, to achieve a clear view of the lung apices and posterior costophrenic angles. Option D. Continuing to follow the established AP chest protocol precisely as taught, assuming the radiologist can interpret the images despite the superimposed scapulae. The correct answer is C. Adjusting patient positioning to ensure the scapulae are rotated away from the lung fields, even if it requires a slight rotation of the patient's shoulders anteriorly, to achieve a clear view of the lung apices and posterior costophrenic angles. Explanation. This scenario presents a common implementation challenge in diagnostic imaging, ensuring consistent and accurate radiographic positioning across different technologists and patient presentations, while adhering to established AT standards. The challenge lies in balancing the need for standardized projections with the reality of patient anatomy and pathology, which can necessitate slight modification to achieve diagnostic quality images. Professional judgment is required to determine when a deviation from the standard projection is justified, and when it compromises the diagnostic integrity of the image, potentially leading to misdiagnosis or the need for repeat exposures. The correct approach represents best professional practice because it prioritizes obtaining a diagnostic quality image that accurately demonstrates the anatomy of interest, while still adhering to the fundamental principles of the requested projection. This involves understanding the purpose of each standard projection, app, PA, lateral, oblique, and how to adapt positioning to overcome anatomical limitations or pathological conditions without sacrificing the essential radiographic information. This aligns with the AD emphasis on competent and ethical practice, which includes the ability to produce technically sound images that meet diagnostic requirements. An incorrect approach that fails to achieve adequate visualization of the anatomy of interest, even if the technologist believes they are adhering to a standard projection, represents a regulatory and ethical failure. This is because the primary responsibility of a radiologic technologist is to produce images that allow for accurate diagnosis. If the positioning, even if seemingly standard, results in superimposed anatomy obscuring pathology or an incomplete view, it fails to meet this fundamental requirement. This could be considered a failure to exercise professional judgment and a potential violation of the ACT Code of Ethics, which mandates providing patient care with respect and dignity and producing high-quality diagnostic images. Another incorrect approach, such as rigidly adhering to a standard projection that is clearly impossible or detrimental to the patient due to their condition, without seeking appropriate guidance or making necessary adjustments, demonstrates a lack of critical thinking and patient-centered care, which are also core ethical tenets. The professional decision-making process for similar situations should involve a systematic evaluation. First, understand the requested projection and its diagnostic purpose. Second, assess the patient's anatomy and any limitations or pathologies that may impede standard positioning. Third, determine if minor, justifiable adjustments can be made to achieve the diagnostic goal while maintaining the essence of the requested projection. Fourth, if significant deviations are necessary, consult with a qualified supervisor or radiologist to ensure the modified projection remains diagnostically valuable and ethically sound. Finally, accurately document any deviations and the rationale behind them. Question 17. System analysis indicates that a radiologic technologist is preparing for a patient examination involving a radioactive source. To ensure optimal radiation safety and diagnostic efficacy, the technologist must accurately differentiate between the properties of various radiation types. Which of the following statements best describes the fundamental penetrating power of common types of ionizing radiation encountered in diagnostic imaging? Option A. Gamma rays are stopped by the outer layer of skin and have very limited penetrating power, similar to alpha particles. Option B. Beta particles have moderate penetrating power, capable of passing through skin, but stopped by a few millimeters of aluminum, whereas X-rays are highly penetrating and require dense shielding. Option C. Alpha particles have the greatest penetrating power and require substantial shielding, while gamma rays can be stopped by a thin layer of paper. Option D. X-rays have very low penetrating power and can be easily blocked by clothing, while alpha particles can penetrate through lead shielding. The correct answer is C. Alpha particles have the greatest penetrating power and require substantial shielding, while gamma rays can be stopped by a thin layer of paper. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the radiologic technologist to accurately identify and differentiate between various types of ionizing radiation based on their fundamental properties, which directly impacts patient safety, radiation protection protocols, and the interpretation of imaging results. Misidentification can lead to incorrect shielding, improper dose assessment, and compromised diagnostic quality. Correct approach analysis. The correct approach involves understanding that alpha particles, while highly ionizing, have very limited penetrating power and can be stopped by a sheet of paper or the outer layer of skin. Beta particles are more penetrating than alpha, but can be stopped by a few millimeters of aluminum. Gamma rays and X-rays are both electromagnetic radiation and are highly penetrating, requiring dense materials like lead for effective shielding. This knowledge is crucial for implementing appropriate radiation safety measures as mandated by AT standards, which emphasize minimizing radiation exposure to patients and personnel through understanding radiation characteristics. Incorrect approach is analysis. One incorrect approach is to assume all forms of radiation are equally penetrating and require the same shielding. This fails to recognize the distinct physical properties of alpha, beta, gamma, and X-rays, violating fundamental radiation physics principles that underpin safe practice and ACT guidelines for radiation protection. Another incorrect approach is to confuse the ionizing potential with penetrating power. While alpha particles have high ionizing potential, their short range makes them less of a concern for external exposure compared to the more penetrating gamma and X-rays. This misunderstanding can lead to inadequate protection against external hazards. A third incorrect approach is to consider only the source of radiation, e.g., internal vs. external, without accounting for the specific type of radiation emitted. ACT standards require a comprehensive understanding of radiation types to implement effective shielding and dose monitoring, regardless of the source. Professional reasoning. Radiologic technologists must develop a robust conceptual understanding of radiation types and their properties. This involves continuous learning and application of principles taught in accredited educational programs. When faced with a situation requiring radiation identification, the professional should recall the fundamental characteristics of each radiation type: alpha, low penetration, high ionization; beta, moderate penetration, moderate ionization; and gamma/X-rays, high penetration, lower ionization per interaction, but can travel further. This knowledge directly informs decisions regarding personal protective equipment, patient positioning, and equipment selection, aligning with the ACT commitment to safe and effective radiologic practice. Question 18. Process analysis reveals that a radiologic technologist is tasked with imaging a patient presenting with symptoms suggestive of a posterior fossa lesion. The technologist must select the most appropriate imaging modality to visualize the cerebellum, brainstem, and cranial nerves within this region. Which of the following approaches best demonstrates adherence to ACT standards for producing diagnostic quality images of the nervous system? Option A. Utilizing X-ray radiography, as it is a fundamental imaging technique, without assessing its suitability for detailed visualization of the posterior fossa's soft tissues. Option B. Opting for ultrasound, as it is a non-ionizing modality, without specific consideration for its limitations in penetrating bone and visualizing deep neural structures. Option C. Choosing computed tomography, CT, primarily because it is generally faster to acquire than MRI, assuming speed is the most critical factor in all neurological imaging. Option D. Selecting magnetic resonance imaging, MRI, due to its superior soft tissue contrast, which is ideal for visualizing the delicate structures of the posterior fossa and differentiating between various types of lesions. The correct answer is D. Selecting magnetic resonance imaging, MRI, due to its superior soft tissue contrast, which is ideal for visualizing the delicate structures of the posterior fossa and differentiating between various types of lesions. Explanation. This scenario presents a professional challenge due to the critical nature of neurological imaging and the potential for misinterpretation or inadequate imaging to lead to delayed or incorrect patient care. Radiologic technologists must possess a thorough understanding of nervous system anatomy to accurately identify anatomical landmarks, select appropriate imaging protocols, and recognize potential artifacts or abnormalities. The choice of imaging modality is paramount, as different modalities offer distinct advantages for visualizing specific neural structures and pathologies. Adhering to ACT standards ensures that the technologist is operating within the established framework of professional competence and patient safety, which is a core ethical and regulatory requirement. The correct approach represents best professional practice because it prioritizes accurate anatomical identification and the selection of the most appropriate imaging modality based on the suspected pathology. This aligns directly with ACT emphasis on the technologist's responsibility for producing diagnostic quality images. By understanding the nuances of nervous system anatomy and the capabilities of various imaging modalities, e.g., MRI for soft tissue detail, CT for bone and acute hemorrhage, the technologist can optimize image acquisition, minimize radiation exposure where applicable, and contribute to accurate diagnosis. This proactive and informed approach directly supports patient safety and diagnostic efficacy, fulfilling the technologist's ethical obligation to provide competent care as outlined by ACT guidelines. An incorrect approach that involves selecting an imaging modality without considering the specific anatomical region or suspected pathology is a significant regulatory and ethical failure. This demonstrates a lack of fundamental knowledge regarding nervous system anatomy and imaging principles, which is a direct violation of AT standards for professional competence. Such an approach could lead to suboptimal imaging, requiring repeat procedures, increasing patient dose and cost, or, worse, missing critical diagnostic information, thereby compromising patient care and potentially leading to adverse outcomes. Another incorrect approach, such as relying solely on pre-programmed protocols without critical evaluation of patient anatomy or clinical indication, also fails to meet professional standards. This passive approach neglects the technologist's responsibility to adapt protocols when necessary and to exercise professional judgment, which is essential for producing diagnostic images. This can result in images that are not tailored to the individual patient's needs or the specific clinical question, leading to diagnostic uncertainty. The professional reasoning process for similar situations should involve a systematic evaluation of the clinical indication, patient history, and suspected pathology. The technologist must then access their knowledge of nervous system anatomy to identify the relevant structures. Subsequently, they must critically assess the strengths and weaknesses of available imaging modalities in relation to the anatomical region and suspected pathology, selecting the modality that will provide the most diagnostic information with the least risk to the patient. This decision-making process is iterative and requires continuous professional development to stay abreast of advancements in imaging technology and neuroanatomy. Question 19. The analysis reveals a patient presenting for a routine chest radiograph exhibits a distinct opacity in the right lower lobe, obscuring the underlying lung markings. The technologist is aware that this finding could represent several conditions, including pneumonia, atelectasis, or a mass. Considering the AT focus on pathology relevant to radiologic imaging, what is the most appropriate action for the technologist in this situation? Option A. Ignore the opacity, assuming it is a minor variation or artifact, and proceed with the standard imaging protocol. Option B. Focus solely on the technical parameters of the radiograph, such as exposure factors and positioning, without considering the clinical significance of the observed opacity. Option C. Recognize the opacity as a potential indicator of pneumonia and ensure the image is technically adequate to demonstrate this finding clearly for radiologist interpretation. Option D. Conclude definitively that the opacity represents pneumonia and adjust the imaging protocol to specifically target this diagnosis. The correct answer is C. Recognize the opacity as a potential indicator of pneumonia and ensure the image is technically adequate to demonstrate this finding clearly for radiologist interpretation. Explanation. Scenario analysis. This scenario presents a challenge in accurately identifying and characterizing pulmonary pathology on a chest radiograph, which is a fundamental skill for radiologic technologists. The difficulty lies in differentiating between common benign findings and potentially serious conditions that require further investigation or specific imaging protocols. Misinterpretation can lead to delayed diagnosis, inappropriate patient management, and potential harm. The technologist's role is to acquire high-quality images that facilitate accurate interpretation by the radiologist, and to recognize when findings might warrant additional attention or clarification. Correct approach analysis. The correct approach involves recognizing the characteristic radiographic findings of pneumonia, such as consolidation or infiltrates, and understanding that these findings are indicative of an inflammatory process within the lung parenchyma. This aligns with the AT emphasis on understanding the pathological basis of imaging findings to ensure appropriate image acquisition and patient care. By identifying these signs, the technologist is contributing to the diagnostic process and ensuring the radiologist has the necessary information for accurate interpretation. This demonstrates a commitment to patient safety and diagnostic accuracy, core ethical principles in radiologic technology. Incorrect approaches analysis. One incorrect approach would be to dismiss the observed opacity as a common artifact or a minor variation without considering the potential for underlying pathology. This fails to uphold the professional responsibility to identify and report significant findings, potentially delaying diagnosis and treatment for a condition like pneumonia. It also disregards the AT expectation that technologists possess a foundational understanding of common pathologies. Another incorrect approach would be to assume the opacity is definitively pneumonia without further consideration of differential diagnoses. While pneumonia is a possibility, other conditions can present with similar radiographic findings. A technologist's role is not to make a definitive diagnosis, but to acquire images that enable the radiologist to do so. Overassuming a diagnosis can lead to premature conclusions and potentially misdirect the diagnostic pathway. A third incorrect approach would be to focus solely on the technical quality of the image, without acknowledging the clinical significance of the observed opacity. While technical quality is paramount, the technologist must also be aware of the pathological implications of what is visualized. Ignoring a potentially significant finding due to an exclusive focus on technical parameters is a failure in professional judgment and patient care. Professional reasoning. Professionals should approach radiographic interpretation with a systematic process. First, assess the technical quality of the image. Second, identify any abnormalities or deviations from normal anatomy. Third, consider the potential pathological causes of these abnormalities based on their radiographic appearance, location, and the patient's clinical presentation, if available. Fourth, ensure the images acquired are appropriate for the suspected pathology and will aid the radiologist in diagnosis. If a significant or ambiguous finding is present, it is professional practice to ensure it is clearly visualized and potentially to communicate with the supervising radiologist or physician if there are concerns about the diagnostic utility of the images. Question 20. Operational review demonstrates that during a complex orthopedic procedure requiring intraoperative fluoroscopy, the radiographer is faced with a situation where the surgeon requests an immediate image to assess hardware placement. The radiographer has a choice between a standard imaging protocol and a modified protocol that uses a slightly higher M setting for potentially faster image acquisition, but with a higher radiation dose. The radiographer also notes that the surgical team is not fully utilizing lead aprons. Which of the following represents the most appropriate course of action for the radiographer in this scenario? Option A. Inform the surgeon that the team's lack of lead apron use is a safety concern and delay the imaging until they are properly equipped, regardless of the surgical urgency. Option B. Adjust the standard protocol by increasing the KVP significantly to reduce exposure time, assuming this will compensate for the increased dose. Option C. Proceed with the standard imaging protocol, ensuring proper collimation and shielding for all personnel, and communicate with the surgeon about the importance of radiation safety for the team. Option D. Immediately utilize the modified protocol with the higher EMA setting to ensure the fastest possible image acquisition, as the surgeon's request is time-sensitive. The correct answer is C. Proceed with the standard imaging protocol, ensuring proper collimation and shielding for all personnel, and communicate with the surgeon about the importance of radiation safety for the team. Explanation. Scenario analysis. Intraoperative imaging presents unique challenges due to the dynamic surgical environment, the critical need for immediate diagnostic information to guide surgical decisions, and the inherent radiation safety concerns for both the patient and the surgical team. The radiographer must balance the urgency of the procedure with the meticulous application of radiation protection principles and adherence to established imaging protocols. This scenario is professionally challenging because it requires rapid, accurate image acquisition while maintaining sterility, communicating effectively with the surgical team, and ensuring optimal image quality for interpretation under pressure. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic efficacy by adhering strictly to ALARA principles and established intraoperative imaging protocols. This involves using the lowest possible radiation dose to achieve diagnostic quality images, employing appropriate shielding for the patient and staff, and ensuring precise collimation to minimize scatter radiation. This aligns with the American Registry of Radiologic Technologists, AT, standards which emphasize radiation protection and the production of high-quality diagnostic images. Following established protocols ensures consistency, accuracy, and compliance with regulatory guidelines for safe and effective intraoperative radiography. Incorrect approaches analysis. One incorrect approach involves prioritizing speed over image quality and radiation safety. This could lead to repeat exposures due to poor technique or inadequate collimation, increasing the patient's radiation dose and potentially compromising the diagnostic value of the images. This violates the ALARA principle and ethical standards regarding patient care and radiation safety. Another incorrect approach is neglecting to communicate effectively with the surgeon regarding image acquisition parameters or potential limitations. This can lead to misinterpretation of images or delays in surgical decision-making, negatively impacting patient outcomes. Effective communication is a cornerstone of collaborative patient care in the surgical setting, as expected by professional radiography standards. A third incorrect approach is failing to utilize appropriate shielding for the surgical team. This directly contravenes radiation safety regulations and guidelines, exposing personnel to unnecessary radiation and demonstrating a disregard for occupational health and safety. Professional reasoning. Professionals should approach intraoperative imaging by first confirming the imaging request and understanding the specific surgical objective. They must then assess the patient's position and the surgical field to determine the optimal imaging approach while maintaining sterility. Prior to exposure, they should confirm the use of appropriate shielding and confirm that all personnel are aware of the impending exposure and have taken necessary precautions. During image acquisition, meticulous attention to technique, collimation, and image processing is paramount. Post-acquisition, clear communication with the surgeon regarding image quality and any potential issues is essential. This systematic, safety-conscious, and communicative approach ensures adherence to standards and promotes optimal patient care.